So we'll make a start now. Thank you very much for attending our webinar this evening on laser vision correction. I'm Aris Constantopoulos. I'm a consultant ophthalmologist at University Hospital Southampton and Laser Vision Eye Centre, based at the Nuffield Hospital in Eastleigh, just on the outskirts of Southampton. And I'm David Anderson, a colleague, consultant ophthalmologist as well, also at University Hospital Southampton, and based at Laser Vision Eye Centre at the Nuffield in Eastleigh. This is basically an informal presentation on laser vision correction, just to take you through the variety of options that are available regarding improving your vision, or if you're wearing contact lenses or glasses. And at the end, there'll be an opportunity to ask any questions that you may have. It will take about 30 to 40 minutes to go through, and then we'll have plenty of opportunity for questions. And you can also contact us afterwards via email to clarify any questions that you don't have the opportunity to ask on the day. As I said, I'm Aris. I'm one of the consultants. I'm a cataract, corneal, and refractive surgeon. I'm also a clinical lead for the ophthalmology services at University Hospital Southampton. My colleague David Anderson, one of the founding partners at Laser Vision Eye Centre, is also based at the same hospital, University Hospital Southampton, and he's also a clinical lead for the cataract services at the hospital. Together, we have a combined experience for more than 40 years. We've been consultant for many years, and we specialize in surgery and treatment of conditions of the front part of the eye. And we'll go on to explain what we mean by the front part of the eye. That involves the cornea and the lens predominantly. We've got a few diagrams and illustrations of videos to take you through the area that we specialize. And the beauty of that is that we just do not provide one procedure for you, for example, just LASIK or surface treatment or SMILE, but we do all sorts of surgery, corneal grafts, cataract surgery, clear lens extraction, other intraocular lenses in the eye. And that allows us to provide the best treatment for what you need and for your particular eyes. So this evening, as I mentioned earlier, we'll cover what laser treatments that are available, what treatment may be the best one for you, and how you can get in touch with us, how can you proceed with exploring the options that you have in practice, especially now that we don't have as many clinical opportunities, although we are returning to some normality now following the coronavirus outbreak. And at the end, we'll have plenty of opportunity for questions and answers. We founded Laser Vision Eye Centre, David Anderson and myself, a few years ago, with the aim to bring excellence in eye care to South Central England and the South Coast. We were the first to bring SMILE to the area. So outside of London, SMILE, a new form of laser vision correction, was not available, and we brought that locally to the area at the Nuffield Hospital. And our aim was to give our patient access to the very best and modern technology, because as we'll go on to explain later, with the best and modern technology, we achieve precision and safety with your procedure. And exclusively we provide procedures such as SMILE and Presbyon, and we'll go on to explain what these procedures are and what they are indicated for. Where can you find us? Obviously at our base, which is at the Wessex Nuffield Hospital in Southampton, also at the Nuffield Hospital in Guildford, and my colleague David does a clinic at the Lido Medical Centre at Jersey. And at all these locations, we can see you and do your screening test to see whether you are suitable for laser vision correction and discuss your treatment options. although our laser and our main treatment center is based at Eastleigh, just on the outskirts of Southampton. We also do clinics at the Southampton Spire Hospital and also at Wisteria Surgery in Lymington. So there's lots of clinics that give you access to come and explore the options for your vision correction. So I can see my colleague has joined me. We had a few technical issues. So can you hear me, David, now?
Good evening, Aris.
Hi, David. How are you? You okay? So we've made a start and just introduced what we're doing tonight, and where we're based predominantly in Southampton, but actually in other areas in Hampshire, and we do a clinic in Guildford, also in Jersey and Lymington, and we're going on to explain now how the eye actually works.
So I think many people in our audience will be familiar with being locked out of the Zoom conference. So it happens to all of us at some time. I could hear you in the background, Aris, so thank you very much. Again, just sorry to skip back to the introduction, but one of the most important parts we like to do on the webinar is take your questions. So you can message us with those questions at any point during the presentation, but just for the sake of kind of efficiency and expediency of the talk, we will answer all of your questions at the end. So please feel free to throw us some questions as we go through, and we will get around to them. If you actually think of those questions after the webinar's over, don't panic. We're very happy to take them later. So just be in touch with us. So I can see on the screen, how do they work? So we've got this incredible structure that's just over 23 millimeters long. Aris has told you before that we specialize very much in the front part of it. I think we've got an animation really that will take you through some of that. So that's, here we are. It's a terrific animation, but you'll see in a moment from the film in the back of the camera. That's the analogy really, is with a camera. So you've got the front part of the camera doing all of the focusing work, and then that image is focused onto the film, now a CCD, which gives you, which creates and turns all of those light rays into a picture. And in our eye, we've got two focusing systems at the front. We've got the fixed focusing system. That's this transparent dome at the front of the eye called the cornea. That has the greatest focusing effect on the eye. And that's the part that we change in laser vision correction. And that's why we use such precise instruments, because with very, very, very thousandths of a millimeter change in shape, we can affect big changes in vision. And then inside the eye, you can see that lens. In this animation, it's yellow. When you've got a nice, healthy lens when you're younger, that lens is going to be crystal clear and transparent. And that lens is the part of the eye that can change focus. So until we hit our kind of 40s, mid-40s, 50s, that lens allows us to change focus and focus on objects way into the distance if we've got good eyesight, but then also close towards us.
So at this stage, I will go on to explain a little bit about the most common conditions, refractive conditions. And by far the commonest where we live is short-sightedness, nearsightedness, or myopia, as it is known in the medical or ophthalmology term. And why do we become myopic, and why do we need glasses for short-sightedness? Basically, there's a mismatch between the refractive power of your eye and the length of the eye. And what happens on that occasion is that the light rays are focused in front of the retina. And what does that mean for you and me? It means that the distance objects are blurry. So when you're looking at the distance, you cannot see clearly, but you can see clearly for reading or near tasks. So that is short-sightedness, so you can see close up, you can see clearly, whereas the distance is blurred. And that's when the eye is a little bit too long for the refractive power of your eye. The opposite of short-sightedness is long-sightedness, which is known as hyperopia or as hypermetropia in ophthalmology. And that is really the opposite of myopia. The eye is a little bit shorter than in myopia or normal. Basically, the light rays come into focus behind the retina. And in this situation, the objects at distance appear in focus, whereas the objects quite close to us are blurry. So that is long-sightedness or hyperopia. And astigmatism. Astigmatism
We've got
is disease, as David says.
We've got another one of these terrible terms that people get labelled with. Astigmatism, it sounds dreadful. It sounds like a disease or a stigma, but it isn't. Like the others, it's a descriptive optical term, and astigmatism means that the cornea typically focuses in different ways in different directions. So almost everybody has a degree of astigmatism. If you were flying fast planes for a living, you might have a little bit of astigmatism, but as you get more astigmatism, so your vision is blurry in all directions. So we hope that we're demystifying some of these terms for you.
And these refractive errors are very, very common, and over half of the world's population relies on some form of visual correction, may that be spectacles or contact lenses. It's very, very common to wear glasses or have some refractive error. And as David said, for very low corrections, for example, of astigmatism, you might not need or know that you have astigmatism, but you'll almost certainly see better if you wear a very small correction. And it's often picked up by a routine visit to the optician. Nowadays, instead of glasses or contact lenses, we have laser eye surgery, a great technology that can overcome the need for glasses and contact lenses. You can achieve great results with laser technology nowadays. And it doesn't remove the inconvenience of glasses and contact lenses, because they can be an inconvenience, especially daily cleaning of contact lenses. Occasionally people sleep in them. So it actually reduces the risks of contact lens wear. And as you heard me mention earlier, we're specialists in cornea. We're based at the University Hospital in Southampton. So we tend to see quite a few complications in relation to contact lens wear. And it's not that uncommon to have someone in the ward with an eye infection in relation to contact lens wear. You agree, David?
Absolutely. I mean, I think I had laser vision correction myself many years ago. My primary motivation really was safety. So my primary motivation was to come out of contact lenses really for the safety of laser vision correction. And in surgery, you know, we work lots of hours and wearing contact lenses often for many, many hours, or as Aris says, occasionally falling asleep in them is not terrific for the health of your eye. And it was really only after I had had laser vision correction, I became much more aware of the other benefits of the treatment. So suddenly you're not taking, you know, your spare contact lenses if you go on holiday, and a pair of glasses and a pair of prescription sunglasses, and then a pair of non-prescription sunglasses because you've got your contact lenses in. So all of those other benefits to me were really almost secondary benefits of the procedure. But of course, you know, they save you a huge amount of time and trouble. And you know, today's busy lifestyles, if we look at a whole host of people, if you're a professional sportsman, like, you know, golfers, Rory McIlroy has had LASIK, like many other sportsmen, or if you just, you know, enjoy going to the gym or relaxing, not having to wear your spectacles or contact lenses can make a big difference. So I think really from those aspects, you just find that you can kind of get on more with life than you can do having to have all of these other optical devices to help you see clearly.
So, I mean, we've mentioned the word laser vision correction several times so far. So what do we mean by the word laser vision correction, and why is laser such a good procedure, and why is it such a desirable operation to have, and why you should actually listen to us? Well, we're going to go on and explain all these terms for you. And what laser means for me and you is that they are very safe, very fast, and painless. And that is why they've moved surgery forward compared to traditional surgery that has been carried out over many, many years, or compared to other parts of the body. And lasers are very, very precise surgical instruments, and they allow us to make very, very small corrections to your eye and the shape of your eye. And that allows us to fine tune your vision to a very, very minute accuracy. And the advantage of lasers being so fast and safe nowadays is that they're also painless. So typically when you have LASIK or any laser vision correction, there's usually no pain experienced. You're aware that there is something happening, but there is no pain or sharpness or anything like that you feel during the procedure. Someone posed a question already, are you awake? Yes, you are awake during the procedure, but you do not feel anything. You do not feel any pain. As I often say, it's much better than going to the dentist. So at Laser Vision Eye Center, we have the most advanced laser technology. And that was part of our vision and our mission when we founded Laser Vision Eye Center back in 2018, to have the best technology. And what you're seeing now on the screen is exactly the layout of our laser room. And you can see behind David, that's actually our laser room. So it's not a fake or sort of a photo. That is our laser room there, which matches the photo that we have on the slide here. And there's two lasers, and I'll go on to explain what each laser does.
We were really lucky. I think, Aris, you probably spoke about when we really founded Laser Vision Eye Centre as a laser suite inside the Nuffield Hospital, giving us really the best of both worlds. We've got all the facilities of a terrific, ultra-modern, super clean private hospital, and in it we've got a kind of sealed laser suite. And I think I first began performing laser vision correction here, way back in 2003, and then prior to that, I was performing LASIK back in 2001. So we had a long history of doing it, and in 2018, really, we had a huge opportunity to update and refresh the suite. So I think we're very confident to say, we really do have absolutely state-of-the-art equipment, and Aris will come on in a moment to talk about some of the newer treatments that allows us to perform. I think this is a really good question here. What treatment is best for you? And I think the most important part of that is the best for you part. So we have a very wide range of procedures, and when you come in to see us, we will spend a significant amount of time with you. So you have a really thorough medical consultation, and during that time we're going to spend a lot of time examining your eyes, testing your vision, doing all of the technical parts to really make sure that your eyes are in the best health. But also we spend a great deal of time finding out what your visual requirements are, what you like doing, because that's where we can really tailor these treatments. And different people like different things. So I have people who are lawyers or solicitors, and I say to them, well, what do you do during the day? And they say, well, I'm on a screen for 8 or 9 or longer hours a day. And when I say, well, what do you do in the evenings to relax? They often say, well, I like reading. So they really value that close to vision, and particularly when you hit your 40s or 50s, that's when you're hitting this presbyopic age. If you are a sportsman, or we live on the south coast here, so we've got lots of people around us who like sailing and being outdoors, they really value that crisp distance vision, so they can see the boys on the water, or if they're skiing or doing something like that. But then also they want to have really good intermediate vision so that they can read the charts on the map. So these are the kind of almost bespoke options, really, where we're spending time to find out which of those is going to work for you. There's a very wide range of procedures. Aris is going to talk to you now about the most frequently performed and the most frequent ways we deliver those corrections. Over to you, Aris.
Yeah, thanks, David. And again, I often say that the majority of patients that come and see us in clinic or come to our webinars or the open events that we do have heard of LASIK. It's by far the most common refractive, it's probably the most common elective procedure that has been performed worldwide. There are probably more than 40 million procedures that have been performed over the past 30 or so years. So it's the most commonly performed procedure worldwide. And that's why it's been fine-tuned to such a great level nowadays. There's other procedures that we'll talk about. SMILE, it's a procedure provided exclusively by Zeiss. It's the particular laser platform that you're seeing just behind David. That's the actual laser that performs the SMILE procedure. And it's a flapless procedure. So it's like keyhole surgery. And I've got a great animation that illustrates that for you. So going on to LASIK that we mentioned, I'll play this animation for you and I'll guide you through the procedure. So as David mentioned earlier, laser vision correction tends to happen on the front part of the eye, the cornea. And here you'll see the old way where the procedure was done, whereas on the right-hand side, you see our modern laser, and those little bubbles create a little plane within your cornea. And LASIK involves the creation of a flap that you see. And then we have a second laser, which is again behind David, and that's called excimer laser. And that is the laser that reshapes your cornea to match your refractive prescription. And then we reposition the LASIK flap down, and within a day or two, that is firmly attached to your eye, and you should be seeing 20/20 vision within the next day or two. Really, really great procedure. It's been around for a long, long time. Like many things in medicine, we're tending to move to smaller keyhole procedures, and SMILE is such a procedure when you compare it to LASIK. And when I play the animation, you'll understand what I'm trying to say. So it's the same laser. So you get these little bubbles within the cornea, and those bubbles now create a little plane on 2 layers, and you get a little disc of tissue that we make a little opening, and the little opening that you're going to see now is only 2 to 3 millimeters, so very small compared to LASIK. And we use some very, very fine instruments. We pull that disc of tissue, we just pull that out, and that allows us to reshape the cornea to correct your refractive error and match the prescription of either your spectacles or your glasses so that you don't need them. So that is sort of SMILE. It's been around for at least 10 years. It's a great procedure. And again, it provides...
We always think it's a new procedure, don't we, Aris? We often say it's often quoted as the fastest growing refractive procedure, but generally in medicine, we're very, very conservative. So new to us means 10 years. I think, Aris, when did you start performing SMILE first?
2015, when I was doing my fellowship in Singapore. So it's been around a long, long time. But because there's not many centers doing it in the UK, it's considered a new procedure compared to LASIK, which is considered the default sort of laser procedure when people talk about laser vision correction. And typically with SMILE, you can return to your daily activities within a couple of days. You should be showering within a few days. LASIK may require another day or two extra compared to SMILE, just because that incision is a little bit smaller compared to LASIK.
And it can be a bit, when you come into the laser room, it can be a bit daunting. You see these very kind of space-agey machines behind us, but I've got the only part that actually touches you in LASIK and SMILE is this tiny little curved surface. So that's the part that sits there, which you really can't feel touch you. You're looking straight ahead. and
You
then
want to see if you can
that
position
part.
that, or do you think it's too much to try and position on the laser? It just goes right there, yeah, just behind that.
Just there.
Yeah, so that's where that little plastic gadget goes, yeah.
So that's the bit that touches you.
Yeah.
Right. So I think some of you may be familiar with the next picture. And those of you that are will know that well. And those of you that aren't will be thinking, well, you know, what happens with readers? But this is something that catches up with all of us eventually, and that's the issue of presbyopia, Aris.
So presbyopia, again, it's another medical term that we use, and again, basically means the need for reading glasses. And with time, we're all going to develop this condition. And it happens because the lens inside the eye, it just doesn't change shape. It just becomes a bit more stiff. And what that means is that we cannot focus. So basically, the lens of the camera cannot zoom in and out, because that's what we normally do naturally and don't really think about it. But with time, that lens just loses that ability. And what happens then is that for reading or close-up activities such as the computer, you might need reading glasses or some kind of an additional visual correction. And with laser eye surgery, we can overcome that need for reading glasses. And again, this is sort of exclusive to the Zeiss laser platform and only available in a few centers in the UK. There's a procedure called PresBeyond. And again, the laser software is very, very sophisticated. And what it does, it corrects your dominant eye. We all have a dominant eye that we prefer to use for distance. And when we see you in clinic, we do a variety of tests, a bit like a camera test, where you used to bring the camera up to your eye. Most people use their right eye in the right hand because most of us are right-handed. So in clinic, we spend quite a lot of time trying to identify which is your dominant eye. And the laser tends to correct that eye for distance. So we give you good distance vision in that eye. And in your less dominant eye, we focus that for near. But the beauty of this procedure is that there's a great overlap between the two eyes. So the focal zone overlaps between those two eyes, so you don't notice the disparity between the eye that's focused for distance and the eye that's focused for near. And again, people often say, well, will I not notice the difference? And no, you do not. It does work, and people are surprised how well it works. We've got patients saying, you know, they went for dinner the same night and, you know, they're really happy reading a menu. We always advise them, don't go out the first night, go home, rest, use your drops. And then it's not that uncommon, people come back and say, oh yeah, I went out for dinner last night, it was great. Or you ask them, don't drive the next day until we see you. And nearly everyone tends to drive to come for the first day visit, particularly the men, but there you go.
And we've just had another great question in, Aris,
yeah.
about presbyopia correction. I think the only other point to mention about this is that each eye is corrected for its error as well. So in other words, if you are short-sighted and you have astigmatism and you are presbyopic, so you need reading glasses for close-up, then the distance eye and the near eye are both corrected for the myopia or the astigmatism, and then you have this this laser blended vision zone in the middle. So we correct the distance eye to have really clear distance, the near eye clear near, and then this blend, which is very natural and preserves your 3D vision.
Yeah. So what shall you do next?
Well, I think one of the issues that we're all aware of now is that everything just takes a little bit longer. So I'm in the suite at the Nuffield this evening, and all of our clinics have been designed now so that we can maintain social distancing in clinic, and you'll come into probably the cleanest environment that you'll ever be in your life. But all of that means that everything takes that little bit longer. So we've got very high demand, and therefore we suggest that if you're going to come in for a consultation, start the process early. And then what are the steps, Aris?
So as David said, we're sort of still in this coronavirus epidemic, although we are returning to some normality, as you heard David say. The first thing to do is get in touch with us. Try and arrange either an e-consultation or a screening visit. Most likely within the next week, or I think if not from next week, we'll be returning to normal, more or less, service at the Nuffield. So we'll be able to offer you proper consultations and screening visits shortly. But the first thing to do is get in touch so that we can arrange a convenient time for you in order to get you in the process of sorting out your vision and your refractive errors. There's a variety of ways of contacting us. You can either send us an email. We've got our phone number there. It's available on our website. Our website is laservisioneyecenter.co.uk. You can also book a free virtual screening. In order to do that, all we need at this stage is your refractive error. That will give us a very good idea with some questions that we can ask, just like we're doing this virtual meeting now. We can guide you through the process and try and identify what procedure would be suitable for you. Of course, we'll still need to see you in clinic. We spend quite a lot of time, as you heard David say, discussing what you actually need or what you would like to improve. So, of course, we need to meet in person, but that should be able to happen in the next few weeks because normal service is starting to resume. But the easiest way to contact us is via our website. You can leave a message or contact us on the number that is available here.
When we talk about refractive error, we mean your optician's prescription. So if you have one, lots of people now bring it in on their phone. So most people have it on their phone. I think that's the other comment we often get. The picture you saw of a man reading is the first sign of presbyopia. But now, of course, most people notice it using their smartphones. And often after treatment, lots of people turn around and say, well, you know, for the first time now, I can actually read my phone comfortably, or I can see, you know, I can see the time on my watch. So that's those are frequent comments after treatment. I think, Aris, you mentioned earlier that both Aris and I are specialists in vision correction. So we spend a great deal of time concentrating on the very front part of the eye. So that's just the first, you know, couple of millimeters really of a 23 millimeter structure. But that means that we can look at a variety of procedures to help you. So we look at laser vision correction first, but there are lots of other ways that we can help correct your vision. And if we don't think you're going to be suitable for laser, or you have a condition that means you're not suitable, you know, don't give up, because we can often treat you with other types of surgery. Very rarely, if we don't think you're going to get the result that you really want out of treatment, we'll say, look, just pause, you know, wait. We're both actively engaged in research and spend a lot of time at scientific meetings. So we've got a really good idea of what's coming through the pipeline, and sometimes, you know, it's better to pause. But I think for the large part, we will treat, you know, the majority of people because we have a very wide range of procedures. So Aris will talk you through. Aris, tell us about these two pictures.
Again, the majority of patients are suitable for laser vision correction. So probably about in the order of 90–95%, I would say, are suitable for laser surgery, which is on the cornea. But if, for example, your corneas are very thin or you have a very dry eye, laser surgery may not be the best option for you. And two other procedures that work really, really well are the two sort of the images that I have on the screen, and I'll explain what they are. So the image on the left is called an ICL, and it's a very much a simple way of thinking of it. It's a bit like a contact lens. And that lens is placed inside your eye, just in front of your natural lens. And that ICL, or that artificial lens, provides the power, the correction that either your contact lenses or your glasses provide. And this lens is so small and transparent that once it's in the eye, no one can notice it. You're not aware that it's there. It doesn't cause any discomfort. Your friends cannot see it. It's transparent. Okay, so it's a great operation. Again, it's done through a tiny little opening, a bit like the SMILE procedure, about 3 mm opening, and within a day or two, that has closed fully. So again, a great option if you're not suitable for laser surgery. The image on the right-hand side is an artificial intraocular lens. And that we tend to reserve if you're not suitable, again, for laser surgery or ICL, or there's a variety of, if you want to see close up and distance, for example, and laser surgery is not for you, then we can perform a refractive lens exchange. So there's a variety of options, even we haven't discussed today, that we consider for you, and we'll only really find out once we see you in clinic and have a full consultation with you. All really great and safe procedures. And again, the most common question I get asked with friends, if whoever, when you mention laser eye surgery, oh, you wear contacts, have you thought about laser eye surgery? No, I can't afford it. Well, laser surgery is probably as affordable, if not more affordable, than wearing contact lenses probably for 15 years. So at some point after 10 years, it's probably advantageous to have had laser surgery. So it becomes cheaper than to have had laser surgery rather than to continue paying for your contact lenses. But anyway, very affordable. It can be affordable as £50 a month. The Nuffield Group provide finance options, including interest-free credit for you. Again, you can see our prices there and compare them to other providers. Very, very similar. So there's not much to compare. Okay.
I think that we ask people when they come in for laser vision correction to bring in some sunglasses, because often your eyes are a bit light sensitive afterwards. And one of the great joys that many people have is that you can actually buy non-prescription sunglasses, and then you can wear them out of the hospital on the day of treatment. So again, it's something, you know, many people, certainly myself, didn't really consider the cost. By the time you've changed your glasses every few years and bought all of these extra bits and bobs, LASIK becomes a very affordable option. And because it's permanent, then you know, you're not going back to all of these other optical devices.
So now we're going to leave it to you. So now we're going to go through the questions that you have sent. So David, it's you want to make a start? It's quite a few questions. So
okay, so we've got, does laser eye surgery hurt? I can tell you again from my personal experience, the answer to that question is no. We put numbing drops in, so your eyes are completely numb. I think the other part of that question that people often ask is, you know, does it feel as if my eye's being kept open? I think that's the other great fear, and the answer to that question is no. So it will feel as if you are blinking naturally. You'll be looking straight ahead. One eye will be open as you look with that little cone I think I showed you earlier. So it will seem very much as if you're kind of looking with one eye open, and that's just resting on the eye. And it's fast. So in SMILE, you're talking about, you know, around 25 seconds to create those planes, and in LASIK probably, you know, 10 seconds or so. So it really is a painless procedure. Aris, you've got number two.
Another question, what should the date of your last eye test be? So yeah, so you heard us mention that it's useful to have the report from your optician with your prescription. That is useful just as a baseline, or if we're going to do a consultation like we're doing now online, because we will repeat all those tests for you in clinic. So yes, it's nice to have a fairly recent report from your optician, but we're going to spend a lot of time with you in clinic finding what your actual prescription is now and how we can modify it to suit what you particularly want to achieve with your laser vision correction. So it doesn't have to be completely up to date. A fairly recent one will be useful, but we're going to go over all those assessments again in clinic.
Yeah, and we like your correction to be relatively stable. So if you do have more than one of those opticians reports, please do bring them with you. We've got another great question here. I've been a contact lens wearer, pardon me, for 45 years, now suffering from dry eye and keen to seek corrective treatment. And in this case, this person is wearing one contact lens for distance and one contact lens for near. So again, a couple of different questions rolled into one. I think if we jumped into the one contact lens for distance, one contact lens for near, this is a form of correction that's been around for a long, long time, and it's called monovision. And presbyond, which is the laser presbyopic correction for that, is a variation on that theme. So in presbyond laser blended vision, what we are doing is we're using one eye for distance and one eye for near, but we are bringing those focal points much closer together. And by bringing those focal points closer together, we allow people to maintain their binocular vision. So you get much clearer, more natural vision. The second part of the question about dry eye, again, you can have dry eye for any number of reasons, but often when you've been wearing contact lenses for many years, your eyes may not be dry, you may just be, your eyes just may be telling you that you kind of come to the end of the line with contact lenses. Certainly procedures like SMILE, in particular if you're short-sighted, are really good in dry eye conditions because they allow the surface of the eye to remain completely intact. They don't interfere with the corneal innervation. And of course, as soon as your eyes have recovered from treatment, then you are not putting that contact lens back on your dry eye.
And to add to this, David, is lots, if not all, contact lens wearers have less dry eye once they have the procedure done, because it's the contact lens really, with time, that is causing this dryness of their eye. So it's being shown consistently, both we've seen in clinic, but also in studies, that once you have your laser surgery, your dry eye goes away if you've had dry eye in relation to contact lens wear. So just to keep going through the questions.
Go on. You take the next one, Aris.
Yeah. Someone faints easily. Will laser surgery be suitable for me? And the short answer is yes, because you're lying flat. So it's a very, very difficult. As you can see, there's the bed just behind that, just exactly there. Underneath that blue light that you see in the middle is the bed that you lie under. So, or you lie on, sorry. So it's very, very difficult to faint when you're lying down. We mostly faint, if not always, when we're standing up. Because basically fainting is when the blood pressure drops in your body. When you're lying flat, it's almost impossible to faint. So yeah, I don't think fainting is an issue.
The other part of that is that we're going to be with you. So all throughout the treatment, you have somebody with you. You have a nurse will be with you in the room. So you're going to be nice and relaxed. We will be there. We will be talking you through every step, and we'll be doing it in just a way really so that there are no surprises. So we won't be telling you in technical terms, but we will be saying, look, you're going to feel a drop happen, or you're going to feel a pressure change, so that there are no surprises during treatment.
Yeah. So another question is, how do you keep the patient still during the operation? You'd be surprised how still you can say. I don't think moving is an issue. I've not had anyone that moves during the procedure. And your eye does not have to stay completely still during the procedure, because that laser knows where your eye is looking, can sort of track any micro movements that your eye is making, and it will compensate for those. So if, for example, you move a little bit, it can make up for it and still proceed. If you move a little bit too much, then you won't proceed with the laser treatment until you move your eye back into the correct position. And that's why LASIK has been around a long, long time. All that technology has gradually crept in. As you keep hearing me say that it's really, really safe, just because of these little enhancements that have developed over the years. So moving per se is not a problem during the procedure. I don't know if you've got anything to add to that, David. But
I think yeah, the two factors are that again we're going to be with you, guiding you through it. The excimer lasers as well have very, very high speed cameras tracking your eye movements. So even if you were to try and look around the room as fast as you can in every direction, to the laser that's tracking you, that's really slow motion. So we're very able to track you accurately during treatment. So at the end of the day, we will be driving the laser, so we will be watching you very carefully all the way through.
And that ties in with the next question. What if I blink during the procedure? And again, blinking or movements of the eye are not usually a problem because, as David said, the eye is tracked. So if you blink or look away, nothing happens to your eye. It doesn't go any treatment if you don't look in the correct direction. How do I know if I'm suitable? Well, we've sort of covered a bit of that. You need a good understanding of your prescription from your optician. We'll repeat those. We'll do lots of tests. We'll assess the shape of your cornea, for example, with something called topography that will map the shape of your cornea, make sure there's no thinning areas or abnormal shapes that wouldn't make laser ideal for you, although we have other treatments available that can strengthen the cornea.
I think the other aspect, of course, is just come in and have a screening.
Yeah.
The screenings are without charge and obligation, and that will give you really an instant idea of whether you are suitable or whether technically you can have laser. And then once you've found that out, then you can come in for a full medical consultation. I've got a great statement about what about women's sport. I took my daughter along when she was 6 to Romsey Rugby Club because she could try out rugby with her friends and classmates, and Smile. These are great treatments for sport, whoever's playing them, and of course people do play. Everyone plays every type of sport now, contact, non-contact sport. So apart from the convenience that you have not having to wear corrective lenses to play sport, of course you also have the safety aspect in that you can go ahead and have these sorts of treatments and still participate in sport. So it removes that barrier really that often people are worried about having poor vision for whatever sport they play. Aris, I've got, is it permanent? Will I have to come in again?
Yeah, it is permanent. So the change in the shape of your cornea, as you saw both with LASIK and Smile, is a permanent. So that's a permanent change to the shape of your cornea. So the change in the refractive power is a permanent change. And will I have to come in again? You may have seen on websites or anything, there's something called an enhancement. And the vast majority of patients do not need an enhancement or a second procedure. And again, a small percentage in the order of 2 to 5% of patients may need a small enhancement. And by enhancement, we mean refining the shape of your cornea so that you don't need any glasses or any contact lens correction as well. Because all the laser is based on the average cornea. Some people, for example, have a slightly more wet cornea. There's a lot of water in your cornea. And when you plan your laser procedure, you can end up with a small minus 0.50 or plus 0.50 correction that we can easily top up for you. And then it's included in the price. And if you're not at 20/20 or better that you would like, we're happy to add that extra bit of 0.50 or whatever it is that you need in order to get you to 20/20 without any glasses or contact lenses.
I think as well, particularly with such high screen use, people are becoming particularly short. I think it's about a quarter of the population now are, or slightly more than that, are short-sighted or myopic. And often we find when I started out in LASIK, often by the age of 19, 20, the vast majority of people had a very, very stable correction. Now sometimes we find that people's short-sightedness or myopia can progress a little later. So we will build that into your correction. So we build in a factor for age and for potentially progression. of your myopia, and if that's the case, then we will top up your treatment or enhance it.
Yeah.
Another great question here for you, Aris. What precautions have you taken for COVID-19?
Yeah. Well, we've changed our practice completely, more or less, since the introduction of COVID. We don't have patients waiting in our area like we used to do in the morning, in the pre-COVID era. We've got 2 meter separation from everyone, so that doesn't allow many patients to be present in the waiting area at any one time. For example, we often run a text system where when your appointment time comes, you'll get a text or a phone call from the receptionist saying, the doctor is ready to see you, can you come in? So we might ask you to wait in the car, for example. So we minimize the contact with other individuals that may be present in the waiting area. Of course, cleaning is slightly different nowadays to what it was before. Everything is cleaned meticulously. Everything that we touch, everything that you touch is cleaned. We wear a mask to reduce your exposure. You'll be wearing a mask when you come into the hospital. So all these precautions that you probably have seen on TV by now and are recommended for everyone, we've already introduced into our practice, and we have been doing over the past 2 months anyway.
We've got, when can we come in for an appointment? I think the answer is more or less now. You're very welcome to come in, have a screening appointment first off, so that you can find out yourself, are you suitable for treatment? And then we can bring you in for a medical consultation, or you can come directly in for a medical consultation, and then we can go from there. So the medical consultation is very thorough, and it will take about an hour, but you can book in for your appointments now.
And a question about aftercare. Yep, as you heard us say, is that if you do need an enhancement procedure, it'll be included in the upfront price. We're going to see you over the next 6 months to 12 months after your procedure on several occasions, so that will all be included. All your drops will be included in the initial upfront cost. So yeah, all that is included. Another question, we talked about SMILE a lot. Is it only available for short-sightedness and astigmatism? The answer for now is yes. Very shortly, and it's not a pun, very shortly it will be available for long-sightedness as well. But for the time being, it's only available for short-sightedness and astigmatism. Yes, correct.
Very good for high corrections as well. I think we probably have probably the majority of the SMILEs that we've done actually have been for higher corrections. So very good for high correction, because it offers great stability of the cornea, and again, very good for dry eyes. The next question is really good. Would both eyes be done together? So are they done at the same sitting? Yes is the answer to that. When I started LASIK back in 2001, we were doing big, large-scale clinical trials for LASIK, and in that time we used to proceed with one eye at a time. So people would come in and have one eye treated, and then because it was a clinical trial, they would have to wait some weeks before the second eye. And the biggest cause of frustration for people was that gap between eyes. So because LASIK is very safe, and also technically, because when you look at the lasers, we create this microclimate around the treatment. We like everything to be very consistent and very stable. So I think I haven't operated, or I haven't performed any laser vision correction on one eye separately from the other for probably a couple of years. I don't know about you, Aris, have you?
No. I think since I started doing laser 5-6 years ago, it's all been bilateral.
Yeah, and you can do it if you really wanted to have one eye treated at a time, no problem at all. But the vast majority of people,
put it that way. Again, it will depend. For laser, we tend to do both eyes at the same time. For an ICL or another procedure, refractive lens exchange that you heard us talk about, then we don't tend to do those We don't tend to do both eyes on the same visit for those. But for laser, we do both eyes at the same visit, yeah. There was a question about keratoconus we missed. I think I have keratoconus. Can laser eye surgery help? And the short answer is yes. There's a variety of options for keratoconus. There's laser eye surgery that usually needs to be combined with some strengthening procedures such as collagen cross-linking or corneal rings. So we offer all these procedures for keratoconus. So it's worth considering some visual correction if you've got keratoconus.
I think the other question we get frequently asked is, what about recovery? What happens then? So you would have treatment. We will then see you either the next day or the day after. So we'll bring you in for that first appointment. We'd then like to see you a few weeks later, and then we have several more appointments over the next weeks to months. So we keep quite a close watch on you, but they're relatively quick. You come in, have a checkup, but we're always available. So the hospital is running 24/7. If you have a question in or outside of hours, then you can always contact the hospital and us. And they can be, you know, sometimes people get home and they realise they've left the drops in the room, or they have any kind of problem. We would urge you just pick up the phone to us. We're here to help you, and there's always somebody on the other end of it.
Again, another question just came in now. Is there a risk of a retinal tear following the procedure? And again, this occasionally comes up in the literature regarding retinal tears and laser. It's very, very, very uncommon to have a tear in general. So after laser surgery, it's even less likely to have a retinal tear, particularly with the lasers that we have. Because the advantage of our lasers is that when you saw David hold that cone up, it actually hugs your eye. It doesn't press on the eye. So lots of lasers, especially the older, although I think all the other laser platforms actually press on the eye when they do the procedure. And that is what stretches the retina out. So in the literature, it's documented as a complication or potential complication. But with modern lasers, in particular the laser that we use, that one does not compress or press on the eye at all. So the inside of the eye doesn't notice any difference whatsoever. So I'd be very, very surprised if anyone developed a tear following laser eye surgery with the VisuMax that you see behind David.
Yeah, I think that the way that curved surface kind of rests on the surface and curves to the curve of your cornea is so light that you can see through it. So you can't see the laser and you can't feel the laser, but what you can see is you can see a little green flashing fixation light. And that's another mechanism that we use to keep your gaze steady. So whilst you're looking at that green light, your gaze is lovely and still and steady, but the pressure is not enough to interfere with your vision. So that kind of illustrates how light the touch is. Brilliant questions, Aris. I like these.
Yeah. It's the most, as we said at the beginning, it's an opportunity to ask questions that you have, and it's the most interesting part of the talk, really. So
I've got a prescription here of prescription of currently 5 and 5.75. Now I don't know whether that's a minus or a plus. Aris, tell us the range of laser vision correction that people can have. So what are the ranges that we treat with lasers?
I think for SMILE that we talked about earlier, you can really treat up to -10 of short-sightedness. LASIK can treat similar degrees of up to -10, but SMILE is a bit more stable than LASIK. So it's sort of, as we mentioned earlier, it's a preferable procedure to have compared to LASIK. Again, for +5 is possible with LASIK, but not with SMILE. Again, it's at the sort of borderline range of what we would like to do for laser eye surgery.
Although we have a very wide range of prescriptions that we can treat, we'd like you to be in the sweet spot. for treatment. So we want you to be in the best. Thank you. I've just had that flash up. It's a minus correction, so yeah, no problem with -5 and no problem with -5.75. We like you to be in the sweet spot. So what we're really interested in is what treatment is going to give you the best vision. And when we're right at the extremes of those corrections, then we will often offer you alternatives. So I think the first implantable Collamer lens that I performed here, that would have been in about 2005, was for a young lady who was about -16. So she was -16. So she had these really, really thick glasses. When you have that type of correction, it's actually physically difficult to wear glasses because even with thin lenses, the weight of the glasses are so heavy that they tend to slide down your nose or press into it. So at -16, out of the range of laser vision correction, but certainly well within the range of implantable Collamer lens surgery. If you have very high plus correction, sometimes we look at either, again, implantable Collamer lenses, but sometimes refractive lens exchanges. So when you get out to the extremes of correction, that's when Aris and I will start talking about other procedures and then the pros and cons of those.
Yeah. I think we've covered all the questions.
I think we have. These are fantastic questions.
Yeah, definitely. It's more interesting.
With dry eyes, we often get asked again here, what about dry eye drops afterwards? We are very keen, we're big advocates of using lubricant drops. Those are drops to treat dry eye. We'll often ask you and give you some to use before you have any procedure done if you need them. So we want your eyes to be in really tip-top condition, and then we'll ask you to use those drops often for a couple of months or longer after the procedure. Your eyes will have healed very rapidly, but keeping them nice and moist with those drops will really help. And again, particularly with lockdown, we get a lot of questions because people are looking at screens for much longer during the day. And we get a lot of questions about dry eye, typically from contact lens wearers. So yes, we encourage you to use lubricant drops, and we encourage you to use them, you know, for several months after the treatment, and we're very happy to provide those for you.
Another question I thought that is often asked is how soon can you go back to work? That's another common question, and it's usually a matter of days with either LASIK or SMILE. And we tend to do most of our lists on a Friday or Saturday. And that gives you that extra margin of the weekend so that by Tuesday, you can definitely go back to work, if not by Monday. We usually advise 2 or 3 days just to be on the safe side, but usually by a day or two. As I said earlier, lots of patients actually drive the next day when they come and see us. So technically you could go sooner, but just to concentrate on the drops. So initially the first few days, you're using quite a few drops, just to help those eyes settle down. So it's important that you focus on using those eye drops. That's why we prefer you not to work for the first couple of days. And after that, you can consider going back to work.
And we will provide you with lots of written information as well. So if you contact us, we can send you out a brochure, but also we'll give you quite detailed instructions. People often say, well, when can I shower? Yeah. When can I do, when can I get back to sports? You know, when I get back to the gym. All of these are things that you can get on with quite quickly. For the first few days, we suggest, you know, how about take a bath for a day or two, just so you don't get jets of water in your eye, or wear swimming goggles. That's quite a good tip. With things like eye makeup, we often get asked, well, when can I wear eye makeup after laser vision correction? You can go back to wearing normal makeup within a few days, but we ask you not to wear eye makeup for about a week, not because of the makeup, but because we don't want you to rub your eyes to remove it. And so we want you to avoid rubbing your eyes for the first day or two, ideally not removing makeup for a week. being active, getting back to the gym within a few days. Again, most of these are precautions against you just having, we don't want you to have an accident or a problem and then cause a problem with your eye. So you can do most things quickly, but we will give you detailed do's and don'ts. And if we haven't covered it, I had somebody ask me a day after the procedure when they could go back to skydiving once. That was quite a good question. I get lots of people who road bike. So if you've got anything out of the ordinary, again, please ask us and we can advise you on any specific activity that you like doing.
Okay, I think that is it, I think, for this evening. We've answered all questions. Hopefully you have found this very useful and informative. We've answered all your questions and explained the range of procedures, who we are and where you can find us.
Yeah, so thank you very much. Thank you very much for attending our Laser Vision Eye Centre webinar. We do run these fairly frequently, so if your friends or family or anyone else you know has missed out, then we put the details up on our website and our social media, and they can join in at another time. So thank you very much for attending.
Thank you and have a nice evening. Bye-bye.
Thank you. Have a good evening. Bye-bye now.
Okay.
So, Aris, are we
Gonna end the meeting. Attendees. Yeah, so we'll catch up.
So that was the only. Yeah, I